Great. Okay. So yeah, welcome. Thanks for that introduction, Siobhan. So yeah, more recently I've been doing, so I've got a broad interest in young people's well-being, but more recently looking particularly at youth loneliness. So today I'm going to talk about a few recent papers I've been involved with on this topic, looking at known predictors and also the importance of social context. Um, so before I start, I just want to clarify what I mean by loneliness and why considering youth loneliness is important. I think Kia gave us a nice flavour for the importance of loneliness. But as human beings, we have this innate need for social connection. So from birth, we start seeking out relationships. First with caregivers, then peers, friends, eventually romantic partners, and so on. And those connections help us to feel safe. They help us feel supported and better equipped to handle some of the challenges that we might face through life. So when those connections are lacking or they're not meeting our emotional needs, then we experience loneliness. And loneliness is typically defined as that distress, that sort of that unpleasant feeling we have when we're unhappy with the quantity or quality of our social relationships. And it's important to distinguish between social isolation and loneliness. So where the social isolation refers to the number of social contacts someone has, which is objective and measurable, loneliness is actually the subjective feeling. So it's the feeling that arises when there's a gap in the relationships we want and the actual relationships we have. So that means someone could actually be surrounded by others, have lots of, social connections, but still feel lonely. And also another person might be alone and feel perfectly content. So that's an important distinction. It's also important to note that occasional feelings of loneliness are a normal part of life. We all at some point feel loneliness. And in fact, these temporary experiences can be really useful because it signals to us that something's missing, something's not quite right, and that can motivate us then to go and seek a connection. So it can be adaptive. But what I'm focusing on today is not that feeling of loneliness that's transient. It's about more chronic or severe loneliness, that can be rather harmful over time. And loneliness among children and young people, as Kia said, is actually quite common. So a recent global meta-analysis suggested that about 10 to 15% of young people across the world were experiencing chronic loneliness. And that matters. That's really important because there's also a wealth of research that shows that adolescent and young, child loneliness is linked to a range of really negative outcomes like poor mental health, poor well-being, poor physical health, reduced academic performance, diminished employment prospects later in life. And these things are not only damaging for the individual, but they also have broader societal consequences. So if you look at the economic cost of increased healthcare costs and things like that, it has a wider impact. So it's really important that we try to prevent and reduce loneliness among children and young people. But to do that, we first need to understand why some people are more vulnerable to chronic loneliness than others. In other words, what are the drivers of loneliness for children and young people? And once we understand that, that can help us then develop effective interventions and policies. So the first study that I want to discuss is a recent systematic review that we conducted about longitudinal risk and protective factors for loneliness among children and young people. And this review was led by Suzanne Bucher from Witten University in Germany, in collaboration with me and colleagues from Whitton, University of Manchester and University College London. And we conducted this review with the aim of synthesising all the longitudinal evidence from quantitative studies on the predictors of loneliness in youth. And specifically, we wanted to identify risk factors. So those are characteristics or experiences that lead to increased loneliness, and also protective factors, which are factors that are likely reduce the likelihood of experiencing loneliness. And the reason for that, understanding those, is because this can then feed into how we develop interventions and policies to reduce the risks and to enhance the protective factors. So for this study, we followed PRISMA, so a set rigorous approach to doing a systematic review. We searched two big databases, PsycInfo and Medline, and we ended up with 105 eligible studies for our review that met our criteria. So those inclusion criteria were that the participants in the studies had to be under the age of 25 at the time loneliness was measured. The study had to be longitudinal, so the risk or protective factor was measured before loneliness because we wanted to understand the temporal order of these things. And the outcome had to be loneliness rather than social isolation. What did we find? Well, we found that of these 105 studies, there was a really wide range of potential factors, drivers of loneliness that had been studied. And these included individual characteristics like personality traits, behaviours like social media use, included factors around peer relationships like friendships, peer acceptance, factors such as family environment, and some studies on wider environmental factors like neighbourhoods characteristics. However, the strong and consistent evidence about these factors was limited. So many of those factors had only been studied once or twice maybe, or we found that the findings were inconsistent across studies. And there could be lots of reasons for that inconsistency. So it could be that different age groups were looked at, it could be different measures were used, different study designs and things. So this doesn't mean that these factors aren't important, but more that we need more evidence. The evidence base is still developing. That said, there were several risk factors that were consistently identified across multiple studies. And these were low peer acceptance. So these are all risk factors, so they lead to increased loneliness. So low peer acceptance, peer victimization, so had experienced bullying, depression, social anxiety and other internalizing symptoms, so like emotional difficulties, shyness and neuroticism. So, where do we go from there? What are the implications of this? What did we find out from doing this review? Well, the findings suggest that it's important to think about developing interventions that target some of those areas that we found there was consistent evidence for. So, for example, social and emotional learning interventions could be useful as they aim to reduce peer victimization or the effects of it, aim to build self-esteem and some of that. So they're tackling some of those factors that we found to be consistently associated with poor loneliness, increased loneliness. But it also suggests we need more longitudinal research into these factors. So things like social media use, physical health, adverse childhood experiences. There's good reason to think they might be important, and there's also cross-sectional research that suggests they're important. However, the evidence is really quite limited and inconclusive. Also, more research into the role of more distal factors or social determinants is needed, because a lot of these studies, they were very much looking at individual characteristics or behaviours that might influence loneliness, and not many had really considered the wider social determinants or factors. And also, we need more research on different age groups, so especially looking at early predictors of loneliness and predictors at different life stages. So many of these studies focus on school age, sort of primary and secondary school age. A few had looked at very early life experience and how that might affect later loneliness, or looking at those same predictors at different life stages, because there may be differences there. Okay, so while that study helped us gain insight into some of those individual and interpersonal drivers of loneliness, like personality traits, relationships, and so on, much of the quantitative research, as I said, focus on those immediate personal factors. And we want to know more about the broader social context in which children and young people live, and understand if those environments shape their experience of loneliness as well. And one important context to consider is neighbourhoods, because neighbourhoods are a key environment where children and adolescents grow up and interact and relationships outside of home and school. And they may influence loneliness in different ways. So, for example, neighbourhoods could shape the kinds of social interactions young people have, interactions with neighbours, participation in community events, the availability of safe parks or community centres or youth clubs or sports facilities can either support or limit opportunities for connection. Neighbourhoods can foster a sense of belonging and inclusion, or conversely exclusion and isolation. And also, neighbourhood safety, it can be important, because that could affect how freely young people explore their environment and engage with others. So lots of reasons to think that neighbourhood is an important social context for loneliness. So in this study, this is what we looked at. So we were looking at the neighbourhood effects of loneliness among adolescents. The aim of the study was to investigate the link between a range of neighbourhood characteristics and loneliness among adolescents aged 12 to 15 in Greater Manchester. And for this, we used quantitative data from the Be Well project, which is a project in Greater Manchester that focuses on youth well-being. A survey was developed with children and young people, and that has been given to schools across Greater Manchester, and that data has been used to try and understand wellbeing and to make improvements for young people. The project now is much bigger, so it's like in different areas. It's not just in Manchester, but this particular study used data from the very first wave that was in Greater Manchester. And so for that study, we had actually, that's not right. So we had 36,000, not 6,000, 36,141 adolescents from 1,590 neighbourhoods across Greater Manchester. And the sample was broadly representative of Greater Manchester and England, but had a slightly higher proportion of Asian participants and fewer white participants. And we linked the data from the Be Well survey that had data about loneliness, but also about individuals' perceptions of their neighbourhood. We linked that then to administrative data at the neighbourhood level. And for this study, we looked at neighbourhood. It's called a lower super output area. But basically it's a small area. It's not as big as like a council area. It's got around 650 households, so I think about 1,500 people or something in one of those areas. And this is because we were thinking that young people spend most of the time in their immediate neighbourhood rather than across a council, so we chose that unit for neighbourhood. And we carried out some multi-level modelling, so data modelling using that linked data to look at how much variance in loneliness, so how the difference in loneliness between young people was explained by neighbourhood factors as opposed to individual factors. We looked at whether loneliness inequalities differed across neighbourhoods. So we find that certain groups, like those from ethnic minority backgrounds, or actually sometimes we find not from ethnic minority backgrounds, may experience different levels of loneliness, or depending on gender might experience different levels of loneliness. And we were seeing if those inequalities were the same across neighbourhoods or different. And we were also looking at the association between neighbourhood characteristics and loneliness. So if there was any link there. So what did we find? Well, we found that there was a small but significant proportion of the variation in adolescent loneliness that was explained at the neighbourhood level. So 1.18% of variation was explained at the neighbourhood level. We found that loneliness inequalities by ethnicity, gender identity and sexual orientation differed across neighbourhoods. So this suggests that the local context can either buffer or exacerbate the loneliness experienced by those groups. And we also found that specific neighbourhood characteristics influenced loneliness. So things like higher skills deprivation among children and young people was associated with increased loneliness. More geographical barriers like limited access to services and transport was linked to more loneliness. Lower population density, so maybe fewer opportunities for social interaction was linked to loneliness, and so on. And we also found that young people's perceptions of their environment, their neighbourhood, was important. So those had negative perceptions of their local environment, so that maybe they felt unsafe or low trust in others, or they didn't feel supported by people around them, or they didn't feel that neighbours were very helpful, or there weren't good places to spend time. They felt more lonely. So yeah, so we found a few different things. So what does that show? Does neighbourhood really matter? Well, we can see this as only a small neighbourhood effect, but it could be meaningful in practice. So neighbourhoods are relatively stable environments, and even modest influences could have cumulative impacts on young people's well-being and loneliness over time. And we did find that individuals' perceptions of their neighbourhood seemed really important to their well-being and loneliness. So the findings do suggest that neighbourhoods matter. Urban planning, community development, investment in local resources could play a meaningful role in supporting youth mental health and reducing loneliness. And it highlights the importance of looking beyond the individual and consider the broader environment in which young people live. In terms of looking at strategies to support loneliness, something more multi-level, maybe individual support plus community investment, could be the most effective. So building on that understanding of how neighbourhoods shape youth loneliness, this next study looked at school and country level factors as well as individual factors. So this study was led by Rebecca Jeffson at the University of Manchester and involved myself and collaborators from the Universities of Manchester, Exeter and Southern Denmark. And this study aimed to firstly explore how individual school and country level factors are associated with adolescent loneliness. And secondly, to examine whether loneliness is linked to academic performance. But I'm focusing more here on the school and country level influence. And by looking at these broader contextual influences, we hope to uncover potential targets for intervention both at school and policy levels. So for this study, we used data from the 2018 wave of the PISA service. That's a programme for international student assessment. So it's a massive data set. I don't know how familiar you are with it. Contains a lot of academic data from across a large number of countries, but also contains information about loneliness as well. So we used that data. The sample was really big, so we had like 518,000 plus 15-year-olds from across 75 students in the sample. And again, we used a multi-level modelling approach to investigate, so data modelling to investigate the association between individual factors, school factors and cultural dimensions to see their influence on loneliness. What did we find? Well, we found that in this study, 2.2% of the variance in loneliness could be attributed to school level factors and 3.4% to country level factors. So again, while these percentages might seem small, they are meaningful in large scale population studies, especially considering the stability of school and national context. Interestingly, we did find that there was data in the PISA about young people's perceptions of the school climate, and we found that those were consistently linked to loneliness. So things like the disciplinary climate in the school, teacher support, teacher interest, peer cooperation, perceived discrimination were also school climate related factors, and they were linked to loneliness. So that suggests that supportive, inclusive and well-managed school environments might help reduce feelings of loneliness among students. And we also found at the country level that some cultural factors, so really broad cultural factors, were associated with loneliness. So for example, well, we use something that's called like Hofstede's cultural dimensions. It's different ways of thinking about culture. One of those was called high power distance. So this is power distance is about the acceptance of inequality in that culture and acceptance of hierarchy. And we found in this study, for instance, that high power distance, so greater acceptance of inequality and hierarchy, was associated with increased loneliness, which might suggest that if there's social inequality and hierarchy, that might restrict open communication or limit opportunities for meaningful social interaction. And that could contribute to feelings of disconnection. But we would need more research really to explore these cultural dimensions and how they relate to loneliness in more depth. But I think this study highlights that youth loneliness is not just a personal issue, it's shaped by the environments in which young people live and learn. And therefore, interventions and, ways we use to address loneliness should take that into account. So to conclude then, from those studies, I think key takeaways really are that loneliness among young people is shaped by a really complex interplay of individual characteristics and more distal influences, such as the school environment, the neighbourhood context, and even the broader cultural factors in across countries. So to effectively understand and address youth loneliness, we really must adopt a more systems perspective that's recognising the interconnected environments in which children and adolescents grow and develop. So that means not just considering personal traits or immediate relationships, but also the wider social, structural and cultural systems that are influencing young people's experience of connection and isolation. Okay, so yeah, that's all. So thank you for listening,